Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This series for 2021 is being done in partnership with Baycare's Winter Haven Hospital to help you, the community, learn more about our local physicians and the many programs and services that Winter Haven Hospital provides to keep our community healthy and thriving. On today's episode, I have the privilege to speak to Dr. Osama Hlalah. Dr. Hlalah is board certified in medical oncology and is fellowship trained in hematology and oncology. He sees patients at Winter Haven Hospital and also serves as the director of Bond Clinic's Cancer and Research Center. Well, Dr. Hlalah, thank you so much for joining us today.
You're welcome. Thank you for having me.
So explain a little bit about what your role is here in the community.
Okay, so I joined this community about 13 years ago in 2008, and I came to for the oncology clinic to practice this specialties, but mainly to treat cancer patients as well as benign conditions related to blood disorders. And since I came, my mission was to improve these services, as in the past there was no full cancer service. Some procedures were not available, and also my vision was to bring clinical research to town when patients, instead of seeking experimental medicine somewhere else. So we worked on getting that here in Winter Haven area and in Polk County. So it serves like we had patients from also surrounding towns. So my schedule basically starts with making rounds in Winter Haven Hospital to see sick patients and consultations. That includes ICUs, include regular floors, new diagnoses of cancer. And also we have an educational role. We run every week a tumor board, where it's one of the best educational activities, where we meet as a team, include radiologists, include pathologists, surgeons, radiation oncologists, medical oncologists, internists, nurses, nutritionists, genetic counselors. We always meet every Friday to discuss patients in details, what would be the best care that can be provided based on national guidelines. So this is the scope of what I do. Recently, we have a residency program also that adds to the community in terms of education. The Winter Haven Hospital, Baycare have family medicine program in collaboration with Florida State University. Also, we as Bond Clinic, we have a collaboration with Nova Southeastern University from the Bay campus, as well as Fort Lauderdale. Medical students come and work with us, and they chose Bond Clinic as one of their designated clinical sites. So this is in general what we do.
So you're a very busy man, that's for sure.
We our day is dense.
And I feel like so much has expanded. So as we were talking a little bit before the call started, you were actually hired at Bond Clinic when I worked at Bond Clinic.
Yes,
and
you're one of the reasons, actually. You gave me good tour in Winter Haven Hospital and in the clinic and in town. And thank you.
Of course. I'm totally responsible for you being here. I'll take all the credit. No, I'm just kidding. But it's hard to believe it's been 13 years and how much your practice and the scope of your practice has changed over the course of that time.
Yes, we see actually I see change by the day in Winter Haven Hospital. All the facilities here between our clinic as well as Baycare Winter Haven Hospital, we see the progress since I joined. A lot of things, for example, the EMR progress, the electronic health records in the hospital, improved a lot. A lot of facilities, new ICUs, emergency room. That helped me because as a cancer specialist, I work as a part of the team. We're not like, and if I have good ICU system, if I have infectious disease, if I have good nutrition, pharmacy, I see the progress in the pharmacy services. Also, we now do more kind of treatments that they were not available in the past, like me, my colleagues, other oncologists in town, like plasmapheresis, which is technically washing blood for serious conditions, which can save lives. We bring services from outside and do it in the hospital. We also the new cancer medications, the immune therapy is the and targeted therapy is the main thing. We, in collaboration with the hospital, for example, each new like case of cancer or metastatic cancer, we send their pathology specimen to specialized lab to check in depth the DNA of each tumor, and we try to find mutations and targeted therapy instead of classical conventional therapy. So all these things, I see the progress and they're available in town. In addition to the clinical research, we enrolled a lot of patients, even with a community practice. A small town like Winter Haven, we had publications in medical journals. So we are contributing to science as well as helping our patients. And also the screening as well. Like I see more patients get screened.
Well, it's such a comfort to know that if you are faced with a hard diagnosis like cancer, that your whole self is being looked at. I mean, I had no idea the number of people that are involved in the tumor board at the hospital and within the clinics. I mean, to have that many people able to review your case, and you as an individual to have the breadth of experience that each of those individuals sitting around the table have brought through their years of study, through their individual patients that they've been able to work with over the years. I mean, that's just amazing to be able to have that many people looking at you as a patient.
It is. We just wanted to do that to provide our patients with the best possible opinion and service. It's a challenging disease. It's a killer. So we need to use all our muscles. Whatever can be done, whatever can be humanly provided, we try to do that. And it takes a lot of effort. Sometimes people don't know that the patients come. We see the patients for a few minutes, but they don't know what's happening behind the scenes. Mm-hmm. We like at 7 o'clock every Friday morning when people are sleeping, we are meeting and preparing cases and reviewing and intensely sometimes discussing things and reviewing the literature and science. And sometimes we make phone calls to help our patients get the best possible service and diagnosis.
So you mentioned that you do rounds at the hospital and you do different consults within Winter Haven Hospital itself. How do patients end up in your office? I mean, is that one way that they are, or a lot of them referred from other physicians who have done screenings, or how does that work?
Yeah, my practice, when we get outpatient referrals from within our clinics, from our neighboring clinics, Gessler Clinic, Independent Clinic, and Baker Clinics, we receive the cases if they're not too sick from outpatient after diagnosis, typically after biopsy if it's a cancer, or if the blood work is not showing normal results, we receive patients for anemia, thrombocyte, like low platelets, low white count, abnormal proteins, all these things we get from outpatient. And sometimes we get the patient from the hospital, like when we see them when they're very sick, they turn like they're coming with abdominal pain or swelling or bleeding, and then imaging is showing a cancer. The surgeon comes in and removes that cancer, or we help in making the diagnosis by the right biopsy, the right test. So after the patient gets better and no longer needs the acute care setting, we follow them in the office. We discuss with them treatment options. A lot of them, we tell them surgery is adequate. You don't need further chemo or biological or targeted therapy or immune therapy. And a lot of time, after we review the pathology, after we review the case at the tumor board, we counsel patient, we meet with the family and have further discussion, and sometimes we ask national experts. Again, it's like practicing oncology and is teamwork.
Mhm.
Is the true word of teamwork. A lot of people are involved in communication and reviewing things and what, like following the literature. The science changes sometimes almost every few months, like new trials are coming. So we have to review that with the patients so they make informed decision. I like my patients to be part of the team.
Mhm.
We're not like imposing what science or agenda on them. They need to be part of the team.
Mhm. Well, and what I've always admired about you is that you are open to learning and growing in your field. As you said, science is always changing, and what we know today may not be what we know 3 months from now, 5 years from now. So it evolves throughout that time period. And the specific specialty you are in is so broad. With oncology and hematology, there are a lot of things that are packed under that umbrella. So I want to focus a little bit. Of course, October is Breast Cancer Awareness Month, and you certainly have a practice within that field. So just to hone in a little bit on that, I'll first start by asking as a female, as a woman, or a male, because they can certainly have breast cancer as well. What are those signs and symptoms that someone should be looking out for?
We encourage patients, and we like your cooperation as an institution is number one, awareness. And what we like is to prevent, number one, to prevent cancer from happening to begin with. We doesn't like there. It's a lot of cancers are preventable. Okay. Number two, if we're unable to prevent it, we wanted to detect that earlier because we can make a huge difference and cure with minimal interventions if we find it earlier. Number three, if it's a little bit in the later side, we wanted to use all the resources we have to get the best possible outcome. So that's the sequence of things. I will start with prevention to begin with. A lot of cancers, including breast, can be preventable. We know the famous preventable cancers, mainly are lung and arid digestive tract with smoking is number one killer. If we avoid that, few things that we can do, they're very cheap and they make life better as well as prevent cancers and other serious illnesses. Tobacco, minimizing tobacco avoidance, minimizing alcohol, good nutrition, exercise, hydration. All these are very simple things to prevent cancer and other illnesses, and they do contribute in that. Number two is screening. If we screen for cancer, it's a simple test, whether it's like we're talking about breast, it's available everywhere. And there is no good reason to prevent people from doing screening. Even if they don't have insurance, there is always a way to do, like we all cooperate. We see sometimes, a lot of time patients for free, and the hospital will provide that for uninsured patients. So insurance is not a barrier between patients and getting proper screening if they want to.
Mm.
The other screening is done by the patient herself. So we encourage women, especially above the age of 40, is to do self-exam every month. Okay, the self-exam is simple. The lady can learn that with her provider, nurse practitioner, physician, gynecologist, any healthcare provider, primary care physician can teach the ladies how to do self-exam. It's a simple process, takes few minutes. People do it every month or every shower. Or we don't want people to be obsessed with that because, you know, with the lady with the cycle, hormone cycles, people can detect changes. What we want from our patients or healthy individuals is to check that, to train their hands on what's normal, because down the road, if they find something, they will know what's not normal. So that's what I encourage. Initially, it takes a while to learn what normal look like, because every cycle things will be different. In middle cycle also things will be different. But with time, any lady can learn her normal. And when something happens, she will be able to detect that. As I always tell people, everything is teamwork, including this. And the good part about it is the patient is part of the team. So between the patient and the physician and the mammogram, we will detect most of the cancers at very early stage. Some patients, sometimes the mammogram will not see it, but the physician can feel it. And sometimes both the physician and mammogram may not detect, but the patient insists, I feel something. And that's one thing I also encourage ladies. If you feel something, no matter what the mammogram says or the surgeon, ask for another test or just have a follow-up at least. Because oftentimes in our experience, the patient will tell us, I've been feeling that for a while, and they do this mammogram, it's saying benign or something like that. As a matter of fact, this is very stressful for any lady, and we know that. And like the time of having mammogram, between the appointment and doing the test and waiting a week, not sleeping to know the results, it's very stressful. But believe me, it's worth it. It saves lives.
Mhm.
People can be cured at an early stage. So we encourage again, our patients to be part of the team. We encourage our physicians and primary healthcare providers to stay on top of these things, and they do in town. In our town, we really have some of the best primary care providers that they do a good job in screening and preventing illnesses. Now, not only breast, we have now screening the colon cancer screening with colonoscopy, with blood, with stool test, as well as new thing for smokers. Just data have shown that we can save lives if we do, for people who had a history of heavy tobacco use, screening CT scans. And we've been encouraging and discussing that in the tumor board several times. And we see more physicians doing that on a yearly basis for people who had previous history of smoking or heavy, to detect early lung cancer. So
Yes,
that's for the,
and that I just actually had a acquaintance who had just learned about that new screening and had smoked in his past, but thought, well, you know what, I should do it. You know, I might have been 15 years without a cigarette, but I should do it. And sure enough, it detected very small, very early, but cancer in his lungs. And so thank goodness he was his own patient advocate as well, which I think is part of the lesson you've taught us today is, you know your body, and to be your own advocate, and is now undergoing treatment. And because it is so early, the prognosis is extremely good for him to move forward. So, and that is new. A lot of people don't know that that's something that they can be talking to their provider about as to whether they're a good candidate to receive that screening.
So since we're in the breast cancer, like close to the breast cancer month, I always, like, a lot of studies have shown that keeping weight under control, good nutrition, exercise can prevent breast cancer. That's something people don't forget. They think just screening alone. Screening is the second step. I always go with prevention first, if we can.
Absolutely. So you, made the decision 13 years ago to make your home in Florida, and certainly in Winter Haven. And I see you out and about around town a lot. So I know you've really adopted this as your community. What was your training like before you came to Winter Haven? Where'd you grow up?
I mean, I probably across the world. I mean, that's truly. I had training in several sites, like the original medical school in University of Jordan. It's one of the most prestigious colleges in the Mediterranean area. And that was very tough time. You know, medical school is never an easy time for anybody, but it's one of the toughest experiences in life and most enjoyable, because you took the challenge of dealing with sick patients and making difference in their life. So, and after that, I even had my master's degree over there. But then I came to the United States, started in Philadelphia, Pennsylvania. It's one of the academic capitals, where a lot of changes in cancer happened there, like between the Philadelphia chromosome in some of the leukemia, and the PET scan, which every cancer physician uses to guide treatment or diagnosis, was done first at the University of Pennsylvania in Philadelphia. My program was Mercy Catholic Medical Center, or at that time was affiliated with Hahnemann University, Drexel. Then after that, I moved to East Tennessee State University. It's a combined program between ETSU and Vanderbilt. We do the bone marrow transplant in Vanderbilt and the solid tumor oncology in Johnson City, Tennessee. Also, I enjoyed the difference between Northeast and sunny South, beginning with Tennessee and nice mountains. And I still remember the appearance. And for like this time of the year, we're approaching the fall, where you see the colors and all that, and close to Gatlinburg and the Smoky Mountains. So that was enjoyable, scientific as well as life experience. Then I practiced after that a year in Kentucky, close to Lexington for 1 year, and then went again back home internationally. There was a mission. King Hussein Cancer Center was built by NCI here. So I was part of that. Over there, I did some solid tumors as well as bone marrow transplant. And then I came back to the United States, to Florida specifically. And it's interesting. For a few reasons, if you remember, I have my interviews during winter, and the first interview was up north in Maine, and everything was snow. And then we came to Winter Haven. My wife saw everybody in boats and shorts, and the lakes was beautiful. And she said, you just need to sign and then ask about other things. So we fell in love with Winter Haven when we came here. Like, we have a lot of friends around. We have physicians that we know. So the community was growing, and definitely very beautiful city, very nice people around, helpful staff in the hospital as well as in the clinic. It was very welcoming. We had that feeling the moment we came. And I even didn't continue interview process after that. I just decided this is where I want to be practicing.
Well, we are very lucky, and your wife is a very smart woman, so that she made that. Well, Dr. Hlalah, I want to thank you for taking so much time out of your incredibly busy schedule to speak with us today. It just, your message today is so important. The prevention, the screening, and then the treatment, and the fact that you can get all of those things done right here in the Winter Haven community with an incredible team behind you. We are just so incredibly blessed to have you in our community. So thank you so much for taking the time to be here today.
Thank you so much for having me and for giving me the chance to speak with the community and to remember the days like my journey in my career. It's really a very nice time, and thank you so much for that. Appreciate it.
Of course.